That burning sensation in your chest, the sour taste in your throat, the discomfort that keeps you awake at night, it's something many people experience. But if you've noticed that it's gotten worse as you've aged, you are not alone. Why does acid reflux or GERD become more common with age? Have you wondered about that? And more importantly, how can you manage it without relying on medications? If you suffer from frequent heartburn, keep watching because I'm about to break down the real reasons behind it, the hidden triggers most people ignore, and simple natural ways to find relief without depending on antacids or prescription drugs. Welcome to my channel. I'm Dr. Adelita Hamis, a plant-based doctor and health coach. And my mission is to help you take back control of your health and life naturally. And if you're new here, we discuss topics on health, topics on wellness, reversing chronic diseases, and living your best life. Our topic today is to answer why heartburn and GERD or gastroesophageal reflux disease get worse as you age and how to fix it without meds. So what is GERD and why does it happen? GERD, GERD means gastroesophageal reflux disease that happens when the stomach acids or acid flows back into the esophagus or food pipe, causing burning pain, irritation, and long-term damage. Occasional acid reflux is common, but if it happens more than twice a week, it could be a sign of GERD. So why does heartburn or GERD get worse with age? Number one reason, weakening of the sphincter or what we call lower esophageal sphincter, LES. There's weakening. The LES is a muscle that acts like a gate. It's like a gate in the stomach that prevents the stomach acid from flowing back up. And as we age, this muscle can weaken, making reflux more likely. The second reason why it gets worse when we age is slower digestion. Aging slows down digestion, meaning food stays in your stomach longer. That increases the chance of acid reflux. Third reason why heartburn worsens with age, decreased stomach acid, not increase. Many people assume heartburn is caused by too much stomach acid. But do you know that low stomach acid can also be a problem? How is that so? Well, when acid level drops, food isn't broken down properly, leading to fermentation, bloating, and pressure that pushes acid back up. Fourth reason why GERD gets worse with age, more medications. Many seniors take medications like blood pressure drugs, painkillers, and antidepressants that relaxes the sphincter. Remember the sphincter? The gate in the stomach that prevents acid from going up? These medications, some medications can weaken that gate, increasing the risk of reflux. Fifth reason why GERD gets worse with age, hiatal hernia. This condition is more common in older adults, and this happens when part of the stomach actually pushes up through the diaphragm, causing reflux or making reflux worse. Did you know that more than 60 million Americans experience heartburn at least once a month? And about 20% of the population has GERD? So let's talk about the natural ways to manage heartburn without medication. It's possible. Instead of relying acid blockers, which can have a long-term side effects like nutrient deficiencies and increased risk of infections, Here's what you can do instead of medications. Number one, adjust your eating habits. How? First, you can try to eat small meals to prevent overloading your stomach. Second, you can try avoiding eating late at night. Try to finish your last meal at night at least 3 hours before bedtime. Another thing you can do, chew food thoroughly. As simple as that. Chewing your food thoroughly to support digestion and decrease bloating. Now here's a smart move to decrease heartburn. Identify and avoid trigger foods. Kid you not, the common triggers include spicy foods, citrus, caffeine, chocolate, alcohol, and fried foods. All these foods I'm now avoiding because I myself have heartburn issues and at the very least bloating for several years, and it's gone now because of dietary change. Surprising triggers are foods like, even healthy foods like tomatoes, onions, and peppermint. This can also worsen acid reflux. And again, I myself do avoid these foods too as much as possible. Now, the third natural way to decrease acid reflux or heartburn is improving your acid or stomach acid levels naturally. How do you do that? As simple as drinking a tablespoon of apple cider vinegar in water before meals to support digestion, or including probiotics to help break down food properly, or eating more bitter foods like arugula and dandelion greens to stimulate acid production. And there's so many more ways. Now here's the fourth natural way to avoid or decrease heartburn. Change your sleeping position. Seriously? Yes. Well, I encourage you to elevate the head of your bed by 6 to 8 inches to help prevent acid from flowing upward. Or try sleeping on your left side, which has been shown to reduce reflux episodes. Fifth natural way to avoid heartburn, maintain a healthy weight. Yes, that's how far the weight can impact your life. You see, excess belly fat increases pressure on the stomach, pushing acid up into the esophagus or food pipe. So losing just by 5 to 10% of your body weight can make a huge difference in reflux symptoms. So my call for you to take action is take control of your digestive health. Heartburn doesn't have to be a lifelong struggle. By making those simple changes to your diet, lifestyle, and daily habits, you can definitely reduce acid reflux naturally and avoid the long-term risk of medications. Now, I know that the most common medications that your doctor is going to prescribe you with is PPI or proton pump inhibitor, medications like omeprazole, right? If you're on this as a maintenance medications, know that this drug can potentially decrease your magnesium level, a magnesium that can actually supposedly help calcium absorption, preventing your risk for osteoporosis. And we have studies that suggest chronic use of antacids, proton pump inhibitors like omeprazole, long-term use can increase your chance of osteoporosis. If you found this video helpful, hit that like button, subscribe, and comment below. What has worked for you in managing acid reflux? Let's share and help each other. See you in the next video. Bye!